All righty. Hello, everyone, and welcome to the question and answer session with Dr. Ogeer. Dr. Ogeer, thank you so much for being here today. Fantastic talk. Everyone really loved it. The feedback in the chat is awesome. So I'm really excited for the questions that have been listed as well.
Thank you, Leanne. And let me just say thank you to the Center for Human-Animal Bond, to the entire team that pulled this together. I know it's quite a heroic effort on everyone's part. And I want to thank everyone in the international audience. And also thank you for having me. It's just a privilege to be amongst these group of esteemed presenters and just share my story today. So thank you for having me.
Well, thank you. We are grateful for your presence here. So to start, just a reminder for the audience, on the screen that you're looking at below, there's a Q&A button. Please enter your questions there, and I will go ahead and read those to Dr. Ogeer. All right, so first question. Thank you for the excellent talk. How can researchers and practitioners in the HAI field best ensure that they are taking a diversity and inclusion informed lens in their work?
That's an excellent question. You know, when I look at the research that is being conducted currently and that has been conducted to really think about how do we represent as diverse a population as possible, I think it goes to thinking about the demographics of the recruitment of the study population. I think we need to think about even the questions we're trying to answer in those studies. And so really sort of thinking about it in a broad-based approach, but am I recruiting participants in my study population that come from different ethnicities or races, different geographies, for example, different economic statuses or household incomes, different age groups, even thinking about educational levels, because we know certainly from some of the work that has been published even this year by Dr. Park Growing and others from North Carolina State University, where they looked at, dog owner demographics and that desire to seek veterinary care. We certainly see that, when you look at income status, higher income levels were more likely to seek veterinary care. And it wasn't that, individuals who were from a more underrepresented population didn't want to seek veterinary care, but a lot of this goes back to what I mentioned in my talk. Financial limitations really in many ways can restrict that access to care. And so I think as we think about doing studies on human-animal interactions and really trying to highlight where some of the gaps are currently in the results or the outcomes we're looking at with research, we need to think about really thinking about the populations that we recruit and the study participants, but also the questions we're asking in these studies.
Yes, excellent points. All right, so next question. Fantastic talk. You spoke about methods for and benefits of increasing diversity, equity, and inclusion in workplaces and organizational teams. How might these apply and extend to promoting diversity, equity, and inclusion beyond specific workplaces, perhaps in the broader overall field relating to human-animal interaction?
Wow, that's a really interesting question. And I think, again, it goes back to some of the things I mentioned in my talk. When we think about sort of the human-animal bond, for many of us, it starts maybe at an even young age. And as we move into our professional and personal lives, these animals, they keep us connected to something that I think is transcendental, sometimes even above our human-to-human interactions. And what can we do to actually go beyond the workplace to ensure that we're delivering on that value, that connection we get to build with animals? I think it's thinking about really building action-oriented, transformative programs that show the value, that create that environment, that allow people of many different backgrounds to come into scenarios where they see the interaction is being valued, it's being welcomed, and we allow people to represent themselves genuinely in those environments. And I think, when you foster an open environment where people come in and they feel they are making a contribution, they're being valued, they feel that culture of belonging and safety, we're going beyond the workplace. We're going into environments that are school environments. We're going into environments where people are struggling with mental health, where people are in old age homes. I myself have done this, gone into, senior citizen homes with my own dogs as therapy dogs to try to show people that the interaction we have with animals, and myself as a person of color with a dog, is able to, similar to them. This is not a boundary. We all are experiencing the same benefits of this connection. And so I think, through action, through programs, through communication and using our voice, and really just sort of building that culture of belonging and openness around us.
Great. So this question kind of follows up to that one. Are there any resources that you would recommend to individuals in the field who want to grow their or their team's cultural competency?
Yeah, there's a number of different resources, and I'm a little bit sort of maybe narrowed in my perspective in that as a veterinary professional, I really sort of think about what can we do in our area of expertise to be able to increase diversity and inclusion and create that equitable environment and belonging. But certainly I think reaching out to subject matter experts, we've heard many of them speak today quite knowledgeably about many of these areas. There are, I think, and even through Dr. Ogeer and the Center for Human Animal Bond, there are a number of resources. I myself have looked into different publications that are pertinent to my area. And so I would say for anyone who's looking to find a resource, if you have a specific area, there are subject matter experts in those areas, but there are also open platforms that, allow us to sort of search through those to get links or even connect with people. And I'd be happy to sort of help make those connections as well through my own personal connections for people.
Excellent, thank you. And this question kind of builds on that one as well. Sonia asked, what is the best route to get involved in HAI research? And that's a big question, but perhaps you have some advice for that.
Yeah, I think coming from the side of being in an animal health industry and working with a pet care and as a veterinarian, certainly for, I think, many of us who may not necessarily be ethologists or veterinary behaviorists, we recognize that what we do day to day is interact with pet owners. We interact with pets that may be healthy, sick, or injured. And through all that we do daily, we're seeing the impact and the importance of respecting that human-animal bond. And so I would say, if someone is interested in getting involved in the research area and wanting to sort of have a more sort of academic or didactic understanding of what that involves, connecting with some of the key thought leaders who have been highlighted today. I know over the lunch session, a number of the centers came into focus, and during the panel discussion, we had several of those individuals across North America and Europe were also in the discussion. So, reach out. And again, we talk about human-animal interactions, and that is a overlying theme, but there are so many, as you know as well, Leanne, there are many sub areas in there to explore. And so it's a great question. It's a very general question. And so I'm struggling to respond to you in a very specific manner, but there are great resources. And I would say coming to this conference today is a good way to actually start building those connections and just the awareness of what is possible and where else this work is happening and where those connections lie.
Excellent. And this one is, I'm part of a student team at the University of Iowa, this is from Montala, and we are working to create an animal therapy program here on our campus. What can we do to promote diversity and inclusion in our program, although it's a predominantly white institution?
Yes, that is an excellent question. I do have a colleague that, I could specifically connect you with who works on animal-assisted interactions and therapies. And so I'd certainly be happy to take this individual's contact and make that connection. But in response to your question in a more general manner, I think, again, when you describe being in a primarily Caucasian environment and trying to build diversity and inclusion, it's really sort of reaching out to the groups around you within the communities that are of BIPOC origin, or that the people of Black, Indigenous, people of color, people of different, backgrounds, that may be Latinx, Latin American, South American, and they are involved in these communities. And I think just probably running a bit under the radar, where it's difficult to actually understand how do you bring them into these services where we are supporting individuals emotionally, mentally, and just helping them sort of cope with day to day. And I think we're all struggling in many different ways. We've come through, a major pandemic and still at the tail end of it, and trying to figure out where next are we going to be, and what does the next normal for all of us look like. And that is something, that struggle, that desire to find our way through that and find a path forward, transcends the race, color, ethnicity. And so, there are a lot of groups that are focused on these areas. And there's one specific veterinarian I know I have the utmost respect for, who I can connect you with, who will bring to focus many of these groups that are sharing in this purpose of helping us all heal.
Excellent. All right, and it looks like we have time for one or two more questions. The first is, there is a seemingly fine and important line between recognizing how diverse identities can affect people's experiences and feelings around animals, while also avoiding potentially harmful generalizations. As the field works to increase diversity, equity, and inclusion in research and practice, how would you recommend us navigating this line?
Yeah, and I think that's something we have tried in different ways to communicate, right? There are myths and probably presumptions that aren't necessarily accurate, that are still pervading how we perceive individuals and their ability to care for animals, or maybe even making an assumption of misrepresenting what their bond is with their animal, maybe based just on economic status or cultural heritage. And I think those are sort of where communication and just having better awareness that human animal bond exceeds these barriers of whether we're able to provide for our animals or not. We all want to, and it's this fear of judgment sometimes that creates this barrier to us actually seeking care and actually developing relationships that highlight how important this bond is to us. And so I think it's about distilling some of the myths and actually building communities. And one of the things I'll say we have done quite a bit around with Veterinarians Without Borders, and a number of other people working in this area, are around building what are called these One Health access clinics, where we create these clinics where there's care for people who may be marginalized, who may not be able to normally get equitable access to care, but also in those scenarios, providing care to their pets as well. And if we can create that community under that One Health approach, where we bring the people, their pets together, and create that environment where we're helping healthcare and providing access in a way that it's not, it's overcoming this fear they have of judgment and these barriers. And I think we're further ahead in really thinking about where we are trying to deliver care with a One Health strategy that will overcome some of these boundaries and maybe distill some of these myths, because people want that. I have to say, in the work I've done across the globe internationally, people want that. People want to be cared for, and they want their pets to be cared for equally. And we just need to provide them with access and the opportunity to have that. We have a responsibility.
We sure do. Thank you so very much for answering those questions. I think we have 2 minutes left, so I'll ask you one last question. And that is, what is the favorite part of your research or your career thus far, or something that surprised you that you'd like to share?
Thank you, Leanne. That's an interesting question. I would say the favorite part of my career has been that I have had the opportunity to build communities around me in different ways, whether it's through my for-profit or not-for-profit life, and do that in an international way that connects with people. It connects communities, and it goes above my own beginnings, which were very humble beginnings, and show people that through hard work and belief in yourself and belief in the purpose that you have, that you're able to help and deliver on a bigger purpose, and that everything takes time. You know, I always go back to this expression, and I'll share it with everyone, from Amanda Gorman, poet laureate, who said, there is always light. And if we're only brave enough to see it and brave enough to be it, we can be that light. And I have to say, I have been brave enough and courageous enough in my own journey, coming from humble beginnings, to be that light. And so I want to share that with people and give them the courage and inspire them to do that as well.
Well, thank you. And I think many of us are leaving very inspired today. What a great way to wrap up the conference. Thank you so much for being here with us and for your excellent talk. And we look forward to keeping in touch.
Thank you so much, Leanne. Thank you everyone for joining us today. Have a great rest of your day.
Yes. Next up are the closing remarks. So head over to Huva to view those. Thank you.